Hurricanes are large tropical storms that form near the equator and travel across the warm waters of the Atlantic. Hurricanes can grow to be more than 500 miles across and can pack winds in excess of 100 miles per hour. Hurricanes cut paths of destruction thousands of miles wide and have caused billions of dollars in damage. As residents of the Tampa Bay area, we need to recognize that we live in an area that is susceptible to being hit by a hurricane. Along with making sure you have enough bottled water, batteries, flashlights, and canned food, you should also ensure you are prepared to offer first aid in the event you or a loved one becomes injured during a hurricane. After viewing this video series, you will have the information you need to offer first aid for 5 injuries that are common during and after a hurricane, including fractures, eye injuries, concussions, shock, and near drowning. In this segment, Corey will discuss how to properly offer first aid to someone who may be suffering from shock following a hurricane. Remember, after a hurricane, it may be hours before trained medical professionals are able to access you or your family due to high demand for medical attention, storm debris, and localized flooding. If this is the case, what you do in the first minutes following an injury is vital. However, these instructions should not take the place of professional medical care. You should always seek medical attention as soon as you are able following an injury.
Hypovolemic shock is a condition that results from blood not being able to reach vital organs in the body. Severe blows to the body can cause internal as well as external bleeding and can cause someone to go into shock. Some of the signs and symptoms of someone going into shock include sweaty but cool skin, paleness of skin, restlessness, nervousness, thirst, loss of blood, bleeding, confusion or loss of awareness, faster than normal breathing rate, blotchy or bluish skin, nausea, and or vomiting. If you find someone who is in shock, you should move the victim to a safe location, careful to avoid any objects that may be a potential hazard. You should lay the victim on his or her back. Then you should elevate the victim's feet higher than the level of his or her heart using a stable object. You should then loosen the clothing at the neck, waist, or wherever it may be binding, and prevent chilling or overheating. Next, you want to make sure you are continuously reassuring the victim. Keeping the victim calm is vitally important when treating for shock. And finally, you should seek medical aid as quickly as possible.
Now it's time to test your knowledge on treating shock. In the event of shock, what is the first thing you would do? If you answered assess, you are correct. And the next step is move to cover. The third step, if you answered lay on their back, you are correct. The fourth step is to elevate their feet. And the fifth step, to loosen their clothing. The next step, if you answered prevent chilling or overheating, you are correct. And the seventh step, to calm the victim. And the final step on treating shock is to seek medical aid.
The video you have just seen provided a basic understanding of the steps necessary to address an injury that may occur during a hurricane. Review these steps at the beginning of each hurricane season and practice them with your family or friends. Being prepared and taking precautions before the storm arrives should still be your top priority, but accidents may still happen, and by being prepared, you will be able to offer assistance in a critical time. Remember, these instructions are not intended to take the place of professional medical care, and you should always seek medical attention as soon as you are able following an injury. For more information on current hurricane threats and what you can do to be prepared, please visit the National Oceanic and Atmospheric Administration's website at www.nhc.noaa.gov.